Hi, my name is Luke, and I have with me Caleb.
Hi, everybody. I'm Caleb.
And we are from HCAT, and we are going to be presenting on HIV awareness. And that's going to be on how the LGBTQ plus community is impacted and why it's important to get tested. First we're going to talk about us and what we do as a club.
And then we're going to go a little bit into what HIV is.
Then we're going to go into the impact of HIV on the US and the LGBTQ plus community.
And then we're going to briefly discuss the importance of getting tested and then some of the resources that we offer for people who are interested in tested.
So about us. We are the HIV Counseling and Testing Coalition, also known as HCAT, and we're a group of UCLA undergraduate and graduate/medical school students who are committed to reducing HIV and sexual health stigma. And we aspire to empower and initiate change in communities affected by HIV by serving as HIV test counselors and practicing cultural humility and cultural competency. In 2016, only 78% of people diagnosed with HIV were actually linked to care within a month, and only 49% were retained in care. And that's one of the statistics that reminds us of our mission to close those gaps. So as a club, what we do is we hold a weekly meeting dedicated to education surrounding HIV, epidemiology, safe practices, sexual health, and LGBTQ plus culture. In terms of outreach, we hold events at partner sites such as Safe Place for Youth, Illumination Foundation, and Nest Residences, where we offer free HIV education, testing, counseling, and contraceptives. And this is where we do a lot of our breaking down of misconceptions and breaking down of stigma. And of course, we conduct linkage counseling ourselves after we complete a thorough training program that takes about 2 quarters, and we get to administer rapid HIV tests to members of the greater Los Angeles community.
So what is HIV? I'm sure many of you know that HIV is a virus, and specifically it stands for human immunodeficiency virus. And when left untreated, HIV can eventually progress into AIDS, acquired immune deficiency syndrome. And this particular virus attacks the immune system, and over time, this weakens your body's ability to fight infections. Even common infections like the flu or the cold have the potential to make people living with untreated HIV very, very sick. The good news is that HIV can be readily treated before it can even get to the point where it weakens one's immune system and progresses into full-blown AIDS. And today, the best known treatment is known as antiretroviral therapy or ART.
So now we're actually going to talk about the impact of HIV on the US and the LGBTQ plus community. So if we're just looking at the numbers, it's pretty staggering. 75.7 million people have become infected with HIV since the start of the epidemic, and 32.7 million people of those 75.7 million people have actually died from AIDS-related illnesses since the start of the epidemic. In the US alone, there is a current estimated 1.2 million people living with HIV, and only 240,000 of those individuals are actually unaware of their status. So they're living with HIV and they're not getting it treated, and they don't even know that they have it. Among the US population, only 65% of people living with HIV receive some HIV care, 50% were retained in care, and 56% were successfully virally suppressed or undetectable. Now, when we actually look at the LGBTQ plus community, we notice that there is a hugely disproportionate impact on it. And we actually organize these statistics to show that there's still a lot of work to be done. At first, this is pretty infamous, but HIV was first officially called the gay-related immunodeficiency disease, also known as GRID. And so this only contributed to stigma surrounding HIV that extended to the perception of the LGBTQ plus community. In 2013, gay and bisexual men made up an estimated 2% of the US population, but a huge 55% of all people living with HIV in the US. And so you can see the disproportionate impact there. In the present, in 2018, MSM still account for 69% of new HIV diagnoses in the US and 86% of diagnoses amongst men.
So now we're going to talk about getting tested. So why should you get tested? And roughly 1 in 7 people living with HIV in the US do not know their HIV status. And this is particularly problematic because when people know their HIV status, they're more likely to get started with treatment. And early treatment means you are more likely to become what is called undetectable, remain healthy, and completely halt the progression into AIDS. Knowing your status keeps your partners and your community safe and healthy in addition to yourself. As an organization, HCAT recommends testing once every 3 months, especially if you're sexually active or an HIV drug user. And HIV tests range from a simple and quick saliva swab to a blood antibody test that is usually performed in a clinical setting, a doctor's office, or the like. And then now we're going to get into factors for HIV. So we say to our clients that there are 5 fluids that have the potential to transmit HIV. These include blood, cum, pre-cum, anal fluid, vaginal fluid. And so if you come into contact with any of these 5 fluids since your last HIV test, we highly recommend you reserving a free HIV test through HCAT today, or to obtain one at your medical provider of your choosing. Furthermore, if any of the following factors apply to you, we also recommend you getting tested as soon as possible. These include having unprotected anal or vaginal intercourse, having another STI either currently or in the past, such as syphilis, herpes, chlamydia, gonorrhea, sharing needles, syringes, or other injecting equipment and or drug solutions when injecting drugs, receiving uncertified injections, transfusions, transplantation, or other medical procedures, or experiencing accidental needle stick injuries. This applies mainly to health workers.
So that actually takes us to what we can actually offer to you all, and that would be our online testing initiative. So if you go ahead and scan this QR code to visit our website, you can fill out a really short form where you can reserve a free HIV test and also schedule a counseling session with one of our linkage counselors. Things to note here are that this is only available to LA County residents, and also that this test is saliva based, so no blood is involved. Packaging will be discreet, and the counseling session will be scheduled at your convenience if you choose to be counseled. Counseling is optional. There is a way to get a free HIV test, just that.
And if you're not an LA County resident, do not fear. We are in the planning stages of a collaboration with Reproductive Justice Health Center, where we will be able to provide free HIV testing and counseling internationally, even in conjunction with RGHC. So please join our mailing list for updates on that launch, which is hopefully very soon. And if you're interested in becoming a member of HCAT or just learning more information about HIV and testing resources, please visit our website to join our mailing list. And just to look around, you can do so by scanning this QR code or by visiting uclahcat.org. And thank you very much for listening to our presentation.
Yeah, thank you so much. We hope you take advantage of our resources, and we hope to help you out in the future. Thank you.